Morning, everybody.
Morning.
Good morning.
Morning.
Wow, look at all these timely people. This is like some kind
Yeah,
of
this is new.
time.
But we'll
I
just
figured
give
I'd start with
another
some
minute
music.
or
It's
two.
one of my favorite new songs, We Can Take the World, and it seemed appropriate because we are taking on a lot here, people.
Yes.
While we're getting ready, I actually want to give a special shout out to Holly Williams from OPM, who has been on this path with us for 3 or 4 years, making our way to this endowment work that we're going to talk about today. Holly is a great thought partner, and I think OPM doesn't always get the credit they deserve for helping us develop policy and figuring out the money. And this was a complicated one. So Holly, I just want to say thank you so much for your leadership at OPM.
It was my pleasure. I always have it's always fulfilling to be able to support the agency in their path. So I'm glad that my team could help support you all.
Yeah. All right, Eloise, just tell me when to get started.
Um, 1 second.
And I'll turn it over to the LG, who's going to be our
Yes, she's
fearless leader.
here.
Oh, there you are. Okay. Hi, Lieutenant Governor. How are you?
I'm
I
great. Welcome, everybody. Am I on mute? I can't figure out how I get off of mute there because my
You're good.
Okay. Oh, excellent. Okay. Nice to see everybody. Happy summer. We've had a very impactful and very productive legislative session. This transformational Early Childhood Education Endowment Fund. It's so exciting. I have been watching our budget surplus closely, and so we'll look forward to hearing more about that and other initiatives. And really, very exciting. And I think that other states have already started to pay attention to what we're doing here. Because once they've heard, I know that lots of my colleagues across the country are now looking at trying to replicate what we're doing here. So congratulations, and we got a lot of work ahead of us, but it's extremely exciting. So what I'm going to do, just so we can get started, Madam Commissioner, is to seek approval of our March 26th meeting minutes. So does anyone have any updates or corrections? I'll ask about that first.
And just before we get responses, just a quick reminder that the Lieutenant Governor is asking this question of cabinet members. I know we have a lot of people here from the public, which is amazing, but the specific ask is to the cabinet members. And throughout this meeting, the conversations will happen with the cabinet members, but at the end of the meeting, if you are not a cabinet member and you're a member of the public, we have a time dedicated for questions. And you can also feel free to, we're all friends here. You can ask questions and stuff in the chat, and we'll keep, if you're a member of the public, and we'll keep a record of them and make sure we get answers to them. But just again, clarifying, the Lieutenant Governor is asking for questions and for approval of the minutes just from members. And also, in the interest of time, since I can see everyone's name, I will actually take the roll from the list so that we can save time for conversation. But if anyone is here as a designee of a cabinet member, please make that clear in the chat. So sorry, Lieutenant Governor, just wanted to make sure that was clear.
No, thank you for the clarification. It's nice to have public members, and we want them to understand what we're doing. So let's do this. I'm not seeing anybody who has a correction and edit. So I move to approve the minutes of March 26th. Is there a second?
Second, Holly Williams.
Great. Okay, we have a second from Holly. So all in favor, please signify by saying aye.
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 Right, so the minutes are hereby approved and we can get on with the fabulous show.
Okay, thank you. Thank you, Lieutenant Governor. You were such an incredible supporter over the past really 18 months of both the Blue Room panel and really getting out there in public and talking about the endowment and how important it was. And there were certainly some moments of strategizing with you where you helped us find a pathway where there were obstacles. So I just want to thank you for that.
And there were a lot of obstacles, I'll
Yeah.
just say.
Yeah.
So Commissioner, I just would also say back at you because there were moments with our legislative colleagues where people seemed to want things that weren't necessarily simpatico, but we got everybody on the same page, which is hard to do and very exciting. And it's testament to your tenacity, commissioners. So I was proud to help and very exciting development for our state
Yeah.
country.
Thank you. And my tenacity is not always appreciated, so I appreciate your appreciation.
Oh,
but-
I know tenacity when I
So I just want to bring us, now we've been talking about the endowment because it was such a big change, but also bring us up a level to say the goal of this cabinet is really broader than childcare or early childhood. It's really about our whole agency first, birth to 3, home visiting, childcare licensing, childcare, preschool, all of it, but also our connections to other agencies. Now, other states, every state's required to have a state advisory council. And in many states, it's the only place where birth to 3, home visiting, Department of Education and everyone comes together. In our state, OEC houses a lot of the programs, but we also have higher ed here. We have the State Department of Education here. We have DDS has a role, public health. I won't list them all, but so we have, I see people from DPH here. We have people here from all the agencies so that when we have conversations, we think about how the different programs we are working on sit in state government. And it's really important to Governor Lamont that we break down silos and think about ways to work together. And this cabinet and these conversations really help OEC navigate and collaborate. So I really appreciate our other state agency partners who were here. And if folks are willing, just put your name and your role in the chat so that people as they're sitting here can see who else is in the meeting and what's their role. We have members of the parent cabinet here. It might help them to know, Mark Camardo's here from the Department of Public Health, make those connections. So anyway, to the Lieutenant Governor's point related back to the endowment, yesterday we spent an hour with Colorado trying to understand our governance structure, that is the Office of Early Childhood, and how that has helped us accomplish some things. And in the next 3 or 4 months, we'll be talking to New Jersey, Washington, D.C., Maryland, and Hawaii, who want to understand how the structure worked to get us through the Blue Ribbon panel, to get us to the endowment passing. And we really looked to New Mexico for thinking about ways that we could move forward when we were starting to think about this 2 years ago. So states are very much labs for each other. And we've bitten off a really complicated structure here with the local governing partners, trying to use that local community to inform. And it's going to be, we're going to rely on organizations like the cabinet, like our stakeholders group that meets a few times a year to help guide us. So today I want to be very interactive. We have some announcements and updates. We have some exciting updates from home visiting. And we're going to also hear from some of the behavioral health work and things like that. But so just please, as the meeting goes, raise your hand at any point and we'll call on you. And for those of you on Zoom a lot, I think you understand that the best meetings are where people chime in and ask questions. It keeps everybody's attention. So you're helping everybody in the meeting. And I promise I won't read a PowerPoint. I'm going to go through one quickly. but I want you to be stopping me and asking questions. And we're not able to answer all your questions probably, but we'll do our best. Working with OPM, working with the advisory councils we have, we're going to be continuing to evolve really all of our programs. So anyway, just as a welcome. So I have some introductions that are exciting. I'm going to start with OEC introductions. As some of you know, the new administration has closed the child care office, the Administration for Children and Families Child Care Office in Boston. They closed half of any blue state, they closed that office. So we lost our New England sort of office and some of that technical assistance, et cetera. But since I've started here, we've had this great administrator named Sam Reinstein, who has helped guide us through Care for Kids, helped with Head Start, integration of programs. She was really a rock star in the federal administration. But when that office closed, we reached out and she was interested because of all the things going on in Connecticut. So I'm happy to announce our new Chief Operating Officer, Sam Reinstein, who's already making a huge difference here at OEC. And just ask Sam to say hello and say a few words about your background. And she's moving to Connecticut on Thursday for good from Massachusetts. So welcome to Connecticut, Sam. And we already owe you a big debt of gratitude for your work in a month. So we can't wait to see what's next, but just say hi.
Hi, everyone. Thanks, Commissioner. I'm so excited to be joining OEC. As Commissioner said, this is such an exciting time. And I had been working at the Administration for Children and Families at the federal level, and so seeing childcare nationally, and just want to say that Connecticut always was seen as such a leader in early childhood, doing innovative, interesting, just really excellent things for children and families. So I could not be more excited, more proud to be joining the OEC team here. So I think my role is going to be really focused on making sure our internal operations are really efficient just so we can serve children, families, and providers in the state the best that we can during this really exciting time with everything that's going on with the endowment and everything else. So excited to be here, so excited to be becoming a Connecticut resident. And just can't wait to meet you all and look forward to working with you all. So thanks, Commissioner.
Yep. And I see Chris Cools here from the West Hartford Family Resource Center. So you and Logan can have a visit. It's an incredible place now that you're coming
Love
to town. And
great.
we'll get you all oriented. So welcome to Connecticut. As you'll see, we're very family friendly state. So thanks, Sam. It's really great to have you. And I really put some of our place on the national map is because of the advocacy efforts of providers, of parents. They push us to make a system that's really different from other states because they're organized and help us in many ways. So I like to give a shout out to the folks who were advocating. And I think the same thing of our birth to three advocates. I see Nicole on the call, you know, that just really work hard to make sure our system is being responsive. Speaking of responsive systems, I have an announcement to make today that I've sent out to the OEC staff. I'm going to be telling the cabinet and we'll be sending it out to the ECE listserv later today, which is working with the governor's office. We are announcing today that Michelle Cook is going to be our ombudsman at OEC. Now, the term ombudsman, some of you may know and others may not, but it's someone to help us track and organize folks who have concerns or complaints or who maybe have good things to say. But it's a person in the agency that's dedicated to try to resolve challenges, and to have someone solely focused on that, very much coordinated with our federal requirements. You know, we have staff here for birth to three, for Care for Kids, for other parts of our agency that have sort of complaint roles, but it's sort of across the agency. And so this will be for home visiting, birth to three, licensing, even, you know, I see Karen's here from Head Start. If there are Head Start complaints, she'll work with your office to try to resolve. And we said all along, we want to be a responsive agency. And this really gives us someone who's out there listening. And Michelle has years of experience as a legislator, so she knows constituent service. The governor's comment was expanding access to early childhood has been a priority for our administration. Having an early childhood ombudsman means that families and contractors can have a point of contact to help with issues if they arise. And so this is something that was sort of conceptualized during the session. Some legislators had talked about it. Michelle, I don't know if you want to say hi, and she's going to be out there at meetings trying to, if there's a meeting you think she should come and listen, you can reach out to her and she can put all her contact info in the chat. But Michelle, do you want to say hello?
Good morning, everyone. And I'm so grateful for the opportunity to be the OEC's first ombudsman. It's very exciting. And so if there are places that you feel I would benefit, please reach out to me. I will put my cell phone in the chat and my email because we're going to be developing this together. I'm welcome any suggestions, comments, and show ideas, because it would be extremely helpful for us to figure this out, to make this as best as we can to ensure that our families and our children have everything that they need. And we can continue to grow the agency that I so firmly believe in. And thank you all so much for what you guys do too. So thanks, Commissioner.
Yeah, great. Well,
Commissioner,
ahead.
if I could,
Lieutenant Governor, yes, go ahead.
I could just add, this past session, we had so many kids' safety issues. I think that this is just a brilliant move. And I'm really happy that you have chosen Michelle, because she knows the legislature, she knows this whole area, and she knows our state. And I think it's going to be great.
Yeah.
Thank you.
Yeah. Thank you, Lieutenant Governor. Okay, and the next are some new cabinet members who we're announcing. First of all, Chris Jimenez is here. He is a parent cabinet member who's been appointed to the Early Childhood Cabinet by the governor. Chris, do you want to say hi and a little bit about your family and background?
Hi, my name is Chris Jimenez. I'm honored to be here. So thank you to the governor and lieutenant governor for being able to appoint me to this position. Like the commissioner, you said, I was able to be on this cabinet through the Office of Early Childhood Parent Cabinet, where I am the at-large member and I am the only father on that the cabinet. Hopefully we can change that going forward. But my husband and I, we adopted our two beautiful young children, and they're really the reason why I want to continue to advocate for them and for other children across the state.
Great, Chris. Thank you so much. And next is Dr. Nicole Taylor, the administrator of the Office of Behavioral Health and Wellbeing from DCF. Dr. Taylor, do you want to say hi?
Morning, Commissioner.
Good morning.
Morning, Lieutenant Governor. I'm Nicole Taylor. I'm the Chief Admin for Behavioral Health and Wellbeing at DCF. My background is I am a primary care pediatrician, so very interested in early childhood education and the impact that it can have on children and their health outcomes. Thank you.
Thank you, Dr. Taylor, and so great to have the link to DCF as well. They're just great partners over there, and we're glad you're here. Next up, we've had some really cool events recently that we want to give you a brief update about. First, I'll ask Christina Morales to update you about the 10th anniversary of the 2Gen initiative, which crosses agencies as well. Christina?
Thank you, Commissioner Bai and Lieutenant Governor, for having me here this morning. And so I will share my screen. And I think I'm going to do things just a little differently, but on June 18th and in 2025, we celebrated the 10th anniversary of Connecticut's Two-Generational Initiative. We were honoring a decade of progress in advancing family economic mobility. Since 2014, 2Gen has transformed how we serve families by connecting systems, aligning services, and designing policies that recognize the power of supporting parents and children together. And so I thought that I would take us back to June 18th. Many of us were not in that room, and some of us were. And I thought I would just read off my opening remarks. And so I want you to be able to feel what that day felt like as everyone was in the room. And so as I do that, I will also show you a few photos of the event so that you can see what it was in retrospect and also hear some of the remarks that were given that morning. And so on this slide, you'll see the agenda that was offered to everyone in attendance. And so without further ado, it was truly a privilege to be with everyone that morning as we celebrated the 10th anniversary of Connecticut's 2Gen Initiative, a decade of vision, partnership, and impact on families across our state. 10 years ago, Connecticut dared to ask a different question. What if we looked at family well-being not in silos, but as a whole? What if we stopped separating the needs of children from their parents and instead built systems that lifted up both? This was the seed of the 2Gen approach, that we can't move children out of poverty without supporting the adults in their lives and vice versa. And today, that seed has grown into a nationally recognized model powered by the commitment of policymakers, agency leaders, community partners, and most importantly, parents themselves. We took a moment to honor the parent leadership. Over the years, parents have not only shared their stories, they've shaped programs, guided decisions, and helped redesign systems. The voice is essential, and they are stronger because of it. And we are stronger because of it. And so thanks to the work of many in the room and beyond, we've built cross-agency systems to address benefit cliffs, expanded access to workforce training, housing, and early childhood supports, introduced the CLIP tools that help families understand how work and benefit intersect, and develop policy improvements that reflect a true 2Gen lens. So, as we look ahead to the next 10 years, the mission is clear. We must keep pushing for systems that work better together. We must embed the 2Gen approach into the fabric of state government, not as a pilot or a side initiative, but as the way we do business. Because the truth is, the 2Gen approach is not just in programs, it's a philosophy. A philosophy that says family success is economic success, that dignity and opportunity go hand in hand, and that when we invest in whole families, we invest in the future of Connecticut. So to every parent, every partner, every policymaker, and every advocate who has shaped this journey, thank you. You have built something powerful, and I can't wait to see what we build together in the decade to come. And so congratulations to everyone who has been involved in the 2Gen Initiative over the last 10 years. It is a milestone, and here's to our future. And we ended, or at some point in that event, we also unveiled our new 2Gen Initiative logo, a decade of impact, a bold new identity. Thank you.
Thanks, Christina. I love the new logo. That is very cool. And thank you for all your work on that. And just, I could feel it when you were talking. Next, I'm going to ask Karen Pascal to talk about the 10-year anniversary of Head Start. I think no, not Head Start, 50.
60, 0.
60, I meant to say 60.
Thank
Okay.
you so much, Commissioner.
Okay.
Thanks, Eloisa. So definitely want to start with a big thank you to Lieutenant Governor for her participation at our event earlier this month. Honestly, such a champion for Head Start, and we were so excited to have Lieutenant Governor there. So over the last 6 decades, Head Start has provided that window of opportunity to more than 37 million children and their families. Next slide, Eloisa. Louise, are you able to advance?
Yeah, I did on my end. It says Head Start Services. Do you see that or?
No.
No, we do not. So I'll just keep talking. So the next slide is about Head Start.
I'll try again.
very large group doesn't hurt, and especially in these times to remind folks how fantastic Head Start is. So we are a 2-generational model, and we are providing preschool services for children 3 to 5 years old and early Head Start, there we go, services for infants and toddlers and also pregnant women. And so services are provided in public schools and child care centers and family child care homes, or in the family's own home through a home visiting model. And there are 22 Head Start programs across our state, and so that's including grant recipients and delegate agencies. So there is a Head Start program in every county in Connecticut, and they're serving a little over 5,200 slots. The majority of those are Head Start preschool, just under 4,000, and about 1,200 early Head Start slots. So last year, those programs served over 5,700 children and their families. And so this slide that you see here, these are the early care and education and comprehensive support services that are provided to children and their families enrolled in Head Start. So these are really the necessary services that are intentional, and they really help children and families thrive. If you can, the next slide, Eloisa.
Did that work?
It did not. I'm so
Oh,
sorry.
what is going
Delete
on? That's so
the
bizarre.
picture. So hopefully we'll be able to get those pictures to come up. So they're photos
Yeah, let
from
me,
that
I'm gonna
day.
unshare and do what I just did again. I'm so sorry. That's so bizarre.
No problem. So we
There we go.
really planned the celebration around one common theme, and that was homegrown Connecticut Head Start success stories. So we were able to hear some amazing stories from 2 women that day. Monica Morneau was a past parent and staff member from Ed Advance Head Start, and Wendy Bryans, who is a parent and consultant from Team Head Start. So we really wanted to elevate parent and family voice, and now I think more than ever, it's so important to share our Head Start stories. So those are some photos for the event. Wendy's down the bottom in the right-hand corner with the blue shirt, and Monica is in the left-hand corner in the navy blue dress. So blue was the color that day. And next slide. So here is a very, I'm going to leave you with this impromptu birthday shout out that was organized by Lieutenant Governor that day. So it was just a really, really nice event. And I think the more we can share our Head Start stories, the better. You think that'll play, Eloisa?
I don't know. I don't know what's going on right now. Let's see. Did that move?
Yep,
Is it moving?
yep.
Are you
Okay.
sharing sound?
Actually, I'm gonna try one more time something. Hold on.
Seems like it's worth the wait if we can make it work.
It was really great.
Did it? Did it work there?
Yep.
Yeah.
2, 3.
There you go. That was
It's a
worth it.
really nice day. So again, thank you to Lieutenant Governor for coming that day. And Commissioner, we know you were there in spirit.
Yes, sort of. Yes, I was there in spirit. I'm so sorry I missed it. Okay, now we also, another great event we had was for our home visiting program with Help Me Grow. And Luz Rivera, thank you so much for your leadership on the event. It seems like it was a fabulous event from all Elena said. So you want to just give us an update or overview?
Sure. Thank you. Good morning, everybody. Thank you for having me here, Commissioner and Lieutenant. I am very, very proud of OEC co-hosting the 16th annual Help Me Grow forum that took place last week in the city of Hartford, where the birth of Help Me Grow started almost 3 decades ago. It really exemplified cross-sector collaboration, early childhood systems building, and as well as just the opportunity to really strengthen those partnerships. And so we really emphasize the vision of early detection and linking families to essential services. We had 20 local partner representation at the kickoff at Duncan Park, where Dr. Paul Dworkin had received a proclamation from the governor officially announcing July 14th as Dr. Paul Dworkin's day in our state, as well as Hartford Foundation announcing the opportunity, the gifted of a fund under Dr. Paul Dworkin's name moving forward. And so we had over 336 members attend the 3-day across 32 states in the US, as well as the District of Columbia. That day was really a mark of not just a celebration, but a reaffirmation of our vision and mission to support families in healthy development and ensuring that they receive the services that they deserve. Day one then was followed with day two, where all affiliates were able to share what they were doing across their state. And OEC showed up big with 8 workshops offered: birth to 3, parent cabinet, parent ambassador. We had behavioral health initiative also. We had Sparkler, all shining a light in the work that we're doing to support families and children here. And so we are looking forward to building those local and state partnership to ensure families continue to thrive and grow. Thank you.
Thank you so much. It seems like it was such a great event and so much to celebrate. So thank you for that.
Commissioner, sorry.
Any questions or add-ons from folks? Yes, Luz.
We have pictures, but the state server actually blocked the pictures and videos, so I can send that to Eloisa and maybe she can pass it to the team. Thank you.
That would be
I will
great.
send it in the follow-up email. Thank you for that, Liz.
Thank you.
Okay, now we're going to get into some of the meat and potatoes. You guys ready? Here we go. Part of the responsibility of this cabinet is to serve as our state advisory committee for the Child Care Development Fund grant, which funds Care for Kids. So Laura Bennett from Care for Kids is going to give you an update on Care for Kids policies. And then we'll also give an update on sort of the Care for Kids enrollment right now, because Care for Kids is full. But I'm going to turn it over to Laura to take this part of the meeting. Hi, Laura.
Hi, thank you so much for having me here and giving me the opportunity to share what the CCDF policy team has been working on. So the CCDF policy team here at the OEC has been working diligently to develop a new family-friendly policy manual for the Care for Kids program. And from the beginning, this process has been centered around listening to those most impacted, so families and providers. As we started this back in the fall, we began with listening sessions to get that feedback from families and providers. And as we continued to move through for almost the past year of our development and drafting process, as we move through the revision process, we are now seeking an opportunity to get more feedback from parents and providers, which leads me to the next slide, Eloisa, if you wouldn't mind. So
did that work? Sorry, I just want to confirm.
Yes, it did.
Okay, thank
Yep,
gosh. Okay,
thank you.
Figured out the issue. Okay, thank you.
So we have created a public comment platform or portal that will allow an online space for families and providers to leave feedback on the policies that we are developing. So as we collect that feedback, some areas we are looking at are how we communicate, applications during job search, ways for parents to apply, the document timeline of getting things submitted, as well as documents for job verification as you go through that application process. And I also provided the survey link right there, which I also can put in the chat, Eloisa, if that's okay, as well. It'll probably be more accessible through there
Yes,
for
yes.
people. So if you can go to the next slide for me, please. So our getting feedback on these policies it's extremely important for us. It identifies stakeholders' needs. What are the expectations here of parents, providers, administrators? It allows us to tailor policies to needs so that we can identify concerns that are most critical and really need the most attention. We're really focusing on improving accessibility. This feedback will help show areas of ambiguity, allowing us to make revisions. We will ensure effective policies that are practical for all involved. And it also allows us an opportunity to address unforeseen consequences. It can show us unintended consequences so we can adjust for more positive outcomes moving forward. So as the policy team goes through this process, it would be very helpful for everyone to even pass along this public comment portal link and information for anyone. It really only takes about 5 minutes to fill it out. We made it as short as we possibly could, easy accessible for people. It has areas where you can add more feedback if you want to, if you have the time to spend to send in that feedback, that would be fantastic. I will put that in the chat so everyone has it. But we are also sending out information to parents through the mail, to providers through the mail. Our parent cabinet members are also going to be handing out postcards with all this information moving forward. So we are really doing our best to get the word out there of these changes that are being made. And we want as much feedback and input as we possibly can. So any help with that would be fantastic. And that is all that I have on the policy manual. So if anyone has any questions or anything, just let me know.
Any questions for Laura?
And again, just a reminder, because we had quite a few people join. This is so exciting to have 91 people on this call right now. That just right now, when questions are being asked, it's being asked of cabinet members. But if you are a member of the public, we will have an opportunity at the end for public comment, or you can put questions within the chat. So just wanted to clarify that.
While we're talking about Care for Kids, just because we're definitely hearing from a lot of providers, because Care for Kids, some of you, I like to always go back. In 2019, we had fewer than 16,000 children on Care for Kids. We now have 23,000 children on Care for Kids, and we're capped at 23,000 by the budget. And so we've been hearing from providers who are concerned about that, who rely on Care for Kids to help them make their bottom line. I should also say, traditionally there's a big turnover in September, October when kids enter kindergarten and they drop off Care for Kids. So then you get, maybe a couple thousand spaces open up, but they go fast. But just to give you a sense, there are 3,200 families. That's 4,200 children on the wait list right now. So there are a significant number of children waiting for spaces. And right now they're accepting families from January. So it's for families that have been on the list since January. And so there is quite a wait to get in the system. We're happy to answer questions about that. Again, it's important to know that we have expanded to 23,000 and working with OPM and the governor's office, because the amount in the budget would have originally only supported about 18,000. So we were able to keep the additional children on, but there's still a real backlog. So we're happy to answer questions if you have them, or just we've provided the information because we get a lot of questions about this, and you all are sort of ambassadors out there. But happy to answer any questions about Care for Kids.
Commissioner, could you please share those numbers again?
Sure. Right now we have 3,210 families on the wait list, and that's 4,200 children. So.
Thank you.
And sometimes it gets confused if people don't know the many parts of the system. Early Start, those are state-funded childcare preschool spaces that are different than Care for Kids. But for some children, the programs rely on both the Early Start tuition plus the Care for Kids tuition for about 20% of their children who qualify on average. So this does impact the whole system at a level, but we are supporting more children on Care for Kids than we ever have. So, it doesn't mean there's no tension in the system when we say we're supporting more kids than we ever have. So just want to be really honest with you all about where we are. Somebody asked a question, is there fundraising outside of the state budget for Care for Kids? Yes, I mean, Care for Kids is part federal and part state. And the state has matching and there are federal dollars. The other thing I just want to say for those of you following, the endowment and Early Start do not have any federal dollars, nor do they have to follow the federal rules. They follow our state rules. So as there have been some questions and challenges about things like Head Start and the CCDF funds, those are impacted by any new federal requirements. But Early Start and the endowment, which the endowment is basically an expansion of Early Start, those are all state dollars. So those just follow state requirements, for those listening who may not understand that. So we didn't get an increase in our federal funds to increase Care for Kids. So we sort of are where we are in terms of the funding. And I believe, Holly, it was like we added $34 million to the budget to stay at 23,000, correct?
Yes, that is correct.
So each year, like it was a heavy lift. It was actually cut from the appropriations budget. And then working with the Office of the Governor, we were able to get those state dollars reinstated to stay at 23,000 versus go down to 18,000. Okay, I thought there might be more questions about that, but there are not. So I'll move on.
Commissioner, there's one question. in the
Okay.
chat. I don't know if you want to address it now or during public
Sure.
comment,
If
but
it's about, if it's from a cabinet member now, if it's from
The cabinet member. Mhm.
Okay, then no.
it says, do you anticipate federal challenges with immigration status and whether it'll have a negative effect on Care for Kids access?
What we know, and I'll have the Lieutenant Governor make sure I've got this correct, because I know you've been deeply involved in these conversations with the Attorney General and the Office of the Governor. So what I feel free to say, and you can add, Lieutenant Governor, is that we have been meeting as commissioners to talk about this and what the impact is. And we have been, providing information to the Attorney General as requested for any kind of legal challenge. At this point, it's business as usual, and we'll wait for guidance from the Office of the Governor in terms of any changes. But obviously, if you read some of the guidance, there are concerns that this will have an impact. And as we understand the law and read the law, and I see people on from DPH and DSS and DCF, we're all in this position of wanting to serve the families here in Connecticut as best we can, and follow the federal rules so as not to lose the federal dollars that we get now that are supporting tens of thousands of children in childcare. So it puts people in a difficult position, but right now it's sort of business as usual. I'll just ask the Lieutenant Governor if she wants to weigh in.
So I'll just say generally, we know that families are concerned about their immigration status when it comes to enrolling or making use of programs. So just as an example, on Friday, I was highlighting along with the State Department of Education, the summer meals program, which is critical for kids during the summertime because they get meals during the school year, but in the summertime, what happens? And so we were trying to encourage people to take advantage of that program. You don't have to fill out any paperwork, but we know that no matter what the program is, whether it's Care for Kids, whether it's summer meals, so many other things, families have this as a concern. So we are saying business as usual, but we're also saying to families that schools and nutrition programs for kids, these are educational programs for kids. These are safe spaces. We want families to take advantage of them, and we want to encourage them. And we do that knowing that families are concerned. So we're going to keep fighting to protect our families. At the same time, we're trying to be mindful of not losing federal funding. I wish there was a better answer, but that's the answer.
Yeah, I really appreciate that, Lieutenant Governor. And I think what you need to understand is that, the Lamont administration will continue to work with, everything that we have to serve children and families who are in Connecticut. And I think there's a strong commitment, and I'm so grateful for the other commissioners in Connecticut because we are a powerful team and we are problem solving together. But we only have certain powers when it comes to the federal funds. And I will tell you, and Holly knows this, we worked hard to make sure the endowment dollars were just state dollars and not to mesh it with federal dollars to try to keep control of those slots. Because there was a move afoot to try to bring in programs that did have federal dollars, and we were really worried about the nexus of that. And so that was an important, and Lieutenant Governor will remember when we were saying, yikes, if that happens, it changes everything. So thank you for the advocates that helped with that too, because that was just not us. It really has been an inside-outside game of we express concern, but advocates express concern, and we were able to protect the endowment from the federal rules. Okay, we like to make up our own rules in Connecticut, right? We want Connecticut values in that endowment, and I think we've done a great job protecting those. Okay, thank you for that update. And if there are no other Care for Kids questions, and for the public, you can put your Care for Kids questions at the public comment section. So now, cabinet members who might have updates, be thinking about that. We're going to start with Dr. Hanks from our Early Childhood Cabinet member who represents the Department of Housing, who will talk about the Interagency Council on Homelessness legislation. And then if others want to report, cabinet members who have things to update the cabinet on, just put them in the chat and I'll ask Eloisa to read those out after Dr. Hanks finishes. Hi, Shantae, welcome.
Hi, Commissioner Bai. Good morning. Thank you. So good morning to all Lieutenant Governor, members of the cabinet, and guests. I'm delighted to have Sonia Jelks join me today as the Department of Housing staff member who spearheads our work on the Interagency Council on Homelessness, along with Commissioner Mascaro Bruno. I brought Sonia today because I think that she is uniquely positioned to provide insights into our collective efforts. Sonia will be offering a quick overview of the recently passed legislation impacting the council's initiatives. So I will quickly pass the virtual mic over to her. Sonia?
Good morning. I was brought into the Department of Housing early last year when the governor signed an executive order to institute the Interagency Council on Homelessness. And so for the past year and a half, the commissioner has spearheaded this effort to engage as many of our state agencies that impact the work on homelessness. The primary purpose, obviously, is to figure out ways in which we can bring all of our state agencies together around, in many cases, where our clients are similar, and trying to figure out ways that we can slowly and hopefully more long-term implement policies that help us to eliminate homelessness in the state of Connecticut. In many cases, what we started out doing prior to the most recent legislation that was just put in place to codify the Interagency Council for the last year and a half, what we spent our time doing is working directly with providers and with state agencies to identify the issues that lead and cause homelessness for most folks that we encounter in the system, but also to come up with long-term solutions that will help us figure out how we can pivot the state agencies to participate more collaboratively around supporting providers and our community partners who currently more deeply work with this population. We've done everything from implementing work groups that specialize in housing development, meaning part of our issue in the state is not having enough housing, period, to be able to house the people, even those who can afford them. And so the commissioner has made quite a few inroads into how we can work with getting not only housing development implemented in various parts of our state, but also looking to get housing that is specific to the populations of people who we serve, generally those folks who are more difficult to get housed and to stay housed. So people with substance abuse, mental health problems, our elderly, our veterans. And so we've had a focus on specialized housing specifically for those populations of people, in addition to the commissioner's plan and objective to just get more affordable housing to be implemented. In addition to housing development, the commissioner has also implemented a plan that allows us to work with the current system, looking at how we can get providers to work more effectively, to take some of the bureaucracy out of the process so that our providers are spending less time filling out paperwork or chasing down paperwork, and actually being able to help people so that the time periods of how we're able to help people get through the system more quickly so that they can be housed, so that we can remove some of those challenges. In addition to the fact that we have some groups that are working specifically on workforce development. In order to keep people housed, we have to keep them employed. And looking at the technology that we're currently utilizing, HMIS system. We have a whole work group that's working specifically in that area to ensure that the challenges that we've had with HMIS and being able to not only get data in the system, but also to get it out so that we can use that data to better figure out how we can better serve the populations and being able to target our funding and our focus in the specific areas that need them. Data is important for that. And so the commissioner has a focus on a work group that's specifically in that area. And I'm sure many of you have heard, as the commissioner has implemented hubs over the past year and a half that specifically talks about the hubs that are a walk-in option for people who are experiencing homelessness, that allows us to not only have people call 211 to be able to access the homeless system, but we actually have walk-in. We have up to about 21 hubs right now, various areas throughout the state that are allowing folks to walk in and be able to get service. Most recently, as our deputy, as Dr. Hanks is currently displaying, the change that we're looking to make with the current act that's been implemented will now cause us to have some slight differences, but we're going to be continuing with the same flow that we have in terms of our participation with our providers and with state agencies. There are about 17 agencies, as I mentioned, which include most of the state agencies that we have always worked with, our partners with DEMAS, DSS, the Department of Corrections, those agencies that are specifically, in many cases, more directly impacting homeless and housing populations. By October 1st, we're going to be looking to convene our first meeting under this new act. The slight changes from where we currently are is that there will be appointments from various legislative bodies. And so we're looking to get those, we're in the process now of getting those appointments back from the legislative Speaker of the House, the minority and majority leaders, so that we can have their specific representatives that will be looking in the space. If you want to scroll down a little bit, Dr. Hanks, you can see the duties that they'll be in the membership with the appointments. Will allow for the commissioner to continue as the head of the Interagency Council, but there will be multiple appointees that will allow for not only the 17 agencies to still be represented, but we'll have also at this point now providers, advocates, and other community appointments that will also be appointed. So if you are interested in having a specific group or a specific representative be from your state agency to be represented, all the state agencies will be allowed an appointment or the commissioner as the commissioner also has the ability to appoint a designee as well. We've learned through our current process and the new process that we're going to be looking to implement with the new legislative changes to not really change the function of how the Interagency Council and our objectives of ending homelessness in the state. We just think that it's going to allow for some additional voices at the table when we initially mostly had just commissioners that were in the initial executive order that the governor put out. So that's primarily, I think, the gist of where we are. Like I said, we're going to be meeting in October for our first meeting to be able to give a report out. The meetings are scheduled quarterly. At the moment, there's no fiscal note attached to the work that we're doing. We're going to be continuing in the same vein that we've been working within the budget aspects of our various departments. And we're hoping to continue with the current conversations that we've been having with multiple agencies about how, especially in this environment that we're in with potential loss of federal funding, how our state agencies can work better together to ensure that the work that we've started for the past 30 years in the state of Connecticut around ending homelessness continues. Thank you.
Thank you so much, Sonia. Any questions for Sonia or Shante?
I see a question here, a hand raised. Leslie?
Leslie. Mhm.
Yes. I just want to say you have a huge supporter in the Connecticut State Colleges and Universities, and we may not be on your list, but I hope you will consider us there. Several years ago, we did a partnership with the Department of Housing, and we provided rent subsidies for our students. $1,100 meant the difference between nursing students at Capital completing and passing their test and being employed at Hartford Hospital, where we have a desperate nursing shortage. This is a workforce development issue, but for us, again, in terms of longer term solutions, we don't have much money. We have real estate, though. I think there are creative ways to look at how we can support students and allow them to complete and then have a livable wage. So I just want to say, I'll put my email in the chat. Please include us in any of the work that you're doing. We really want to help our students who will then go on, right, to be leaders in the community, including your commissioner. There's so many proud alums from the Connecticut State Colleges and Universities. So we're just here to help. This is a big issue for us.
Thank you so much for that. And the commissioner has started quite a few conversations we've met with some individual state universities at this point, looking exactly at what you just mentioned, nursing programs, social work programs, where we may start to give students those experiences that they also will need for the workforce, but also to use them as potential support for our services. And so thank you so much for offering that as well.
Thanks, Leslie. And thanks, Sonia. Any other questions? Okay, great. Any other updates in the chat, Eloisa?
Nope. I think we're ready to move on to the next agenda item.
Okay. We're going to do a legislative update about the endowment bill now. And I'm going to go through this quickly to try to save time for questions. And Eloisa will share the screen. Okay, we had sort of three bills. One was the endowment bill, which was Senate Bill 1. Then we had the House bill related to the endowment. And then we had the bond bill. And the three worked together to create significant expansion of preschool childcare, infant toddler care throughout Connecticut. Next slide. Oh, sorry, I was one slide behind. Sorry, Eloise, I was looking at my paper ones. Old lady stuff. Okay, so thanks to many on this call, the Blue Ribbon panel sort of set this up for us to set some guiding principles, and really listening both during that process and during the development of SB 1, many public hearings there as well, and well, not so many around SB 1, but around House Bill 5003 and around the endowment, really set the stage for what passed, the sort of transformative bill that passed. Next slide. So, this is the problem we were trying to solve, was both how do we help families afford childcare? How do we make childcare high quality? How do we make sure children with special needs have access to preschool in a way that matches their parents' life needs? And the way that families find out about childcare and preschool options is very idiosyncratic and more dependent on someone they talk to at the playground than on some kind of system that helps guide them and direct them. So there's a big problem, and it's a non-system because as a country, we've never sort of had a childcare system. It's been left to families to figure out, and it's not affordable, and the quality is not where it needs to be. And the workers have been subsidizing the system by accepting subpar wages. So there are a lot of problems, but we wanted to find our way to solutions. Next slide. Through both processes that I just talked about, we knew we wanted a mixed delivery system. And we knew we had to collaborate with SDE. I mean, as an example, now we're probably up to 19,000 children served by Early Start, and there are 19,000 3- and 4-year-olds served in the public schools. And so these systems need to work together. We need to have both systems be high quality and have coaching and teacher development programs that hit both. The other thing is that during Blue Ribbon panel, it was really clear that infants and toddlers is the biggest shortage area, that's where the demand is for centers. But the costs, make that hard for the business model. And that's why there's a shortage of infant toddler care. So we needed to work to address that. And the workforce issues are huge, both, we don't have enough workforce, we don't have the right credentials for the workforce. The pay doesn't draw more people to this profession. And really our higher ed system is not set up with our requirements to work. And we've been working on these things, but I will tell you, it's super complicated to get everything aligned. So we knew we had to work on that. And we worked hard to make sure we're working to build a system that is responsive to family needs. For example, we're pushing this year and telling programs, you can take part-week kids. I know when my grandchild they were looking for childcare, her parents, that, they wanted 3 days a week, but they're in a state-funded program and everything was 5 days a week. So how do we help programs learn to flex and make sure the reimbursement systems don't disincentivize that? But we heard from families that they don't always want 5 days a week, 10 hours a day. So the system has not been as responsive to families as it can be. And working with the parent cabinet and parent ambassadors, we've been working on that. And what ended up coming through was really a collaboration. So much gratitude to the House, the Senate, the Governor's Office, OPM, and OEC to come out with a program that we believe will transform the whole landscape. Next slide. So Senate Bill 1, this is what happened in Senate Bill 1. It establishes the endowment, and this year we put 300 million in, and every year it is designed to take the unallocated surplus before the end of June into the endowment, and then that endowment will get interest and will grow over time, and we can spend 10%. So the dollars are still there, and we spend down 10% as it's growing. So it will continue to grow. And just for your information, people ask me, well, what's the unallocated surplus usually? And it's usually around $450 to $470 million a year. This year it was 300 million. Some of it was used to cover some Medicaid costs that weren't expected. But it's not nothing. And we think this is a really amazing way to grow the early childhood system. And it also, as a fund grows, the 10% grows, and we can serve more families, we can increase the rates, and we can reduce the cost for families. I talked about the first 2 years we can spend 12%, but after that it's 10%. And the other thing I think that was important that got in the bill is this cannot supplant other things we're doing. These funds will grow the system, grow the rates, reduce costs for families, and we can serve more children and families as it grows. Next slide. I should also mention there is an advisory council that we're meeting next week with the House and Senate to try to get name folks on quickly. So for folks on this call who may be members of the public or the cabinet, you know, we want this to continue to be a responsive system, and we believe that advisory council will help. So there are very specific uses for the funds: expanding care, which includes rates and increases in the number of slots. Programmatic costs, which will help with some of those workforce challenges, will support the communities and also be used for technical assistance. And then OEC will need some staff. The whole system will need improved data and technology, and some of that includes a parent portal. Next slide, which I'll explain. I think that comes up in future slides. So this is the thing the governor likes to talk about the most. This starts in 2027. I'm going to say that again. This starts July 1st, 2027, where families making less than $100,000 who are in Early Start programs will pay nothing, no copay. And then parents who make more than $100,000 a year will pay 7%, down from 16 to 27% now. So this is a huge sea change for families. Think about yourself. If you'd had no childcare costs, you would have been able to buy a house sooner, have a car, you know, invest in your child's future, you know, just really an incredible benefit to families. Next slide. This is like almost incalculable what this means for families. I talked about the advisory board that will be administered by the Office of the Treasurer. There'll be a House member, a Senate member, and the Commissioner of OEC as the tri-chairs. And there's some reporting requirements. Next slide. I believe, is the health insurance subsidy in SB1? I guess it is if this is under SB1. There's also going to be a health insurance subsidy pilot, and you're going to see these gold stars on the slide. This means that's for the whole field because, you know, basically this program is expanding Early Start to new programs and existing Early Start programs. But a lot of programs are saying, well, what does this mean for me? How will this help me if I don't want to be part of Early Start, or if I'm just a childcare program in New Canaan? And basically, the health insurance subsidy will start in 2027. Working with Access Health, there'll be a $10 million to subsidize the cost of healthcare for childcare workers. Next slide. Okay, this is House Bill 5003, which is sort of a second leg of the stool. This is well underway, where we're developing a one point of entry portal where families can see what options are available for them in a systematic way. And it can also help programs market. Right now, we basically have 400 programs all marketing to families, trying to get them to enroll without any coordination. So this will help programs by, showing parents what programs are available in their town. It'll also help parents streamline their search process and know what's free, what's low cost, what's in the public school, what has transportation, all those items. And also will be a place parents can apply for various programs. So we're very excited about this. It's going to be a lot of work, but we're going to be having listening sessions around the state to hear what people want and expect from a portal, from families to providers. Next slide.
Commissioner, just
Yeah,
before
go
we
ahead.
move on, just to speak on that, we also will be bringing some of this to the cabinet. So expect to see an agenda item on this in probably this fall. As we have the listening sessions with the public, we also plan to do it with the different groups that are heavily involved in this work. So I just wanted to keep that
Right.
top of mind for cabinet members.
Great. Thank you. So the portal will help all providers and families as well locate early childhood services. Next slide. And this is just sort of a picture to say families can assess what they need. I need 10 hours a day. I need 6 hours a day. I need summer. I don't need summer, and help navigate them to enroll in a program that matches their needs. Next slide. Also, this is going to require us to do prospective payments for Care for Kids starting in July 2027. Right now, we have federal rules that require us to start to pay prospectively before then, but this just, in case those federal rules change, this is there for now. Laura, what is the role, when is the date now? Do you know that we're required to, for the feds, have the prospective payment system? Laura Bennett?
I'm not sure the exact date, but I know that
Kristen, maybe. I don't know if
yeah,
Kristen-
maybe Kristen, or I think there are a few other CCDF team members on, so
Sure.
they may know.
I think
Anybody?
it's August 1st, 2026.
Oh, there, that you used to be the big
Correct.
boss of us.
Yep.
Sam Reinstein weighs in her new role. So thank you for that. So a year earlier. Okay, go ahead. Next slide. It also includes a large family childcare home pilot, and we've been having a whole lot of meetings about this. To try to, if you look at other states, there are way more children served in what we would call in Connecticut group childcare homes, but we have a teeny tiny number because of some of the regulatory issues. So this is to try to think about, well, to pilot, can we have larger family childcare homes as part of the family childcare structure versus a part of the childcare center structure, which requires very different things. So we are working on this, and we've had really nice help from the Connecticut project on this work to try to figure this out with our licensing department and with family childcare providers to get this started. Next slide. And then there is the bond bill. Next slide. So we will, and this is for all providers too, this isn't just for Early Start, to try to help expand facilities and improve the quality of the facilities. And there's an agreement that this year there'll be 11.7 million put on the bond agenda to help expand and improve childcare facilities. Next slide. And that's it. How'd I do, Eloisa? Did I make up our time?
A little bit. We have a few minutes
Yeah, we still
left.
have time for questions.
Yeah.
All right, we're back on schedule, people. I'm sorry I
And-
talk so fast.
And
If
there
we
was
had
a quick
translator, they
update
would have
from
stopped me.
yes. There is a quick update from Karen if you wanna
Sure.
Rainville. In the
Rainbow. What you got?
she wrote in the chat, but Karen, in case you wanna
Yeah.
come
Yeah, no
off and
worries. I won't take a lot of time. I just wanted to let everyone know we're in the final few weeks of open registration for the Connecticut AYC conference, and we have Dan Worry, who is the founder of the Center on Child and Family Policy, and Dan was really active in the Blue Ribbon panel work in Connecticut, and so we're thrilled that he's going to be there with us for 2 days. My info's in the chat. If you need anything or have any questions, reach out.
Awesome. Thanks so much, Karen. That conference was amazing last year. I'm sure it will be again, so.
and I'm just gonna add something because Dan, a huge part of the work we do. He actually wrote this amazing book And that was published last year, so people should buy it.
Anyone who attends will actually get it for free. It's part of the conference.
Oh,
registration, so yeah.
even
Don't
better.
buy it.
Don't buy it.
Even better. Tell others to buy it, please.
But questions about early start? I do want to mention that at noon, we're meeting about a communications plan for early start, because we know we need to get out there with information, both with early start, with the endowment, and with the LGPs, that there's so many things going on at once that people need more information and want more information. And we expect to be both sending out sort of written information and then doing 5 sessions in September around the state to both bring the information out, be live and in person, and let people ask OEC questions. So cabinet members will be made aware of those times. Elliot, I see your hand up. How are you today? You are such a reliable attendee here.
Good. Well, thank you. That was a great presentation. I just wanted to offer a comment, which is to thank you and your team and the governor and lieutenant governor, because what Connecticut has done is really a model for other states, and it's just wonderful to see. So thank you all. I don't have anything else to say, but that was just great.
Yeah, it is exciting. I think that what the other states are interested in, just so you know, what's really different about this program is that we get the rates and we get the affordability before expansion. The reason the systems across the country are on the brink of so many challenges in childcare is that traditionally governors, mayors, everyone picks access over quality and rates and affordability. So we'll expand, but we won't expand until teachers are paid on par with kindergarten teachers, and the rates do that, and that parents have affordable childcare. And so it's very unusual to have that be the underpinning. Usually the underpinning is we've added 6,000 kids, but then that means that less per kid. And it's just eroded the quality and has stressed the system out for the past 20 years. And so I think that's what made Connecticut different. And at one point, Elena and I and Kristen were in the room with the Senate and the House when we came to that realization. We're like, wow, this is really making a statement that we have to be able to recruit and pay high quality teachers. And this has to be more affordable for families. And so maybe we're not adding 10,000 spots right away, but I believe by 2032, we will have added or expanded 20,000 spaces, making this part day more full day in the public schools with the children with special education needs, and just new early start and new smart start spaces. So there's plenty of room for new providers who want to be a part of it. And it will happen over time, so they have time to plan it. The endowment, the beauty of it is it grows every year. And so we can grow systematically, and there will also be an advisory council that can fix what we maybe didn't get wrong or didn't get right. So it's a lot of pressure. And I think right now the pressure is at the local governing partner level, because the other thing that's so different, and trying to explain this to Colorado, originally we had proposed that there'd be a regional structure in Connecticut, but during the Blue Ribbon panel, we are Connecticut, and the feedback was no, we like our local councils, we want local. So we'll have 120 local early childhood organizations doing the planning. And this is a huge undertaking, trying to get them resourced, trying to make sure that parents are at the table, et cetera. So I think that's another really outstanding part of our system, but that makes it much more complicated, is what's that local governing partner going to look like in my town? And should my town join with another town? And should we do this regionally? And so there are like probably 15 decisions that each local community is going to try to be making. And we believe that they will also leverage local resources. So it can't be all the state. The towns need to step up too with some options for families. And we believe having that local data and local governance will make it the state and local will work well together. But there's a lot of pressure right now. People want to know more. They want to understand more. They want to just know exactly what it's going to be like. And we don't have 100% of the answers, but what we're going to try to do, like we're doing today, is keep communicating. And those of you who have been following this all along, every step of the way, it feels like pressure is building on this. This is now there's the money, now there's this model, now we got to go. But Billie Jean King says pressure is a privilege. And I keep saying that the pressure that we're feeling in our agency is a privilege. And the people at OEC are working so hard and on overload and overtime to connect it to other systems and to make the system work. So I'm really grateful to them because it's a lot of pressure in these walls at 450 Columbus Boulevard as we're adding. I think we now have like 450 contractors from having 100 and something. And then that pressure goes to OPM that has to approve now 450 contracts instead of one. But you know, so it's a lot. But I think because we have a great advocacy community, we have a great team at OEC, and the governor's commitment, and Lieutenant Governor, that we're ready, but it's still going to be stressful, and we need you to communicate with us when you hear things that you think could be better. And you're our advisory council, so we're open. You know, our lines of communication are open. Sorry for that little riff. Okay, Renee.
And just to add to the complexities of all this, also remembering the school district's obligations under IDEA and providing free appropriate public education and determining what is the child's least restrictive environment is part of that IEP meeting. So we also want to ensure that the messaging that we're providing around this for families does not always mean that the school district is going to provide a full day if the child's IEP could be implemented in that half day. Some of that is determined in that PPT meeting. And it's so complex, and this is something that we're really taking a closer look at too, even transitioning from birth to 3 to preschool special education, because they're two different systems, and helping families understand those differences. So the messaging around this is going to be so important, you know, for families to really understand the complexities of this.
Yeah, yeah, and we're going to have to work together too, because one of these goals is to turn those half-day programs into school day, school year programs. But you're right, the law may not require it, but
Right.
hopefully with funding from the endowment, the districts. What we found when we talked to superintendents is they very much would like to do school day, school year, and give the kids a full day, but the space and the funding is not there. So we're going to have to really, those local community needs assessments are going to have to give us a picture across the state of what will it take to be able to meet that goal. So I appreciate you raising that, Renee. Other questions?
Commissioner, just really quickly, Ava brought up a really great question that we have not spoken to yet, but if there is any feedback, questions regarding the endowment, please feel free to reach out to me. I'll put my information in the chat, and I'm happy to field questions. I just want to reiterate, we might not have all the answers right now, but we do want to be responsive and, you know, at least have a contact to be able to ask the questions. And we will be out in the field very shortly as well to hear all of the feedback and questions and concerns there as well. So I'll put my contact information in the chat and feel free to reach out.
Great, thank you so much. Any other questions? Wow, okay. I think we have a group that's been pretty up to date on this, and a real thank you to Maggie Adair, who makes sure we keep communicating this wherever we go and help people understand what's happening. And Kristen, thank you for the communication update, because you are definitely, you know, our point person in the commissioner's office for the endowment, and we appreciate that. So, you know, if you have questions or ideas, you can reach out to Kristen. Caroline, good to see you.
Good morning. I'm so sorry I can't be on camera. I'm also working, but
Yeah.
I'm so happy to hear of all of the things that are going on. And I'm sorry that I haven't been able to talk to you or even see you during this whole time. But my greetings to everyone. I have some home care workers, excuse me, not home care workers, providers. And they're asking about maybe having their own listening sessions, their own, meeting groups. And I know that I mentioned it to you before. And when I'm listening, I'm like, oh yeah, I need to send you an email. But I just wanted to bring it up again. Um, just because they have their own, of course, unique set of circumstances happening. And
Mhm.
so I just wanted to highlight that as
Sure.
well, to, maybe consider having a meeting session for them or something specific where they can voice their concern
Yeah.
with accreditation and all of it.
Definitely. I think the more we can communicate, the better. And so, Caroline, it could be helpful to try to help us sort of envision what that would look like. And we could add that on to the listening sessions that we're starting in September to make sure we're reaching people where they feel comfortable communicating with us and can do that. So that's a really good suggestion.
Thank you. And I'm always here. I'm ready. So just let me know what
Great.
needs to be done. And it's great to see you.
You too. Anything else? I think what
We're
I
in the
just want to add one thing, Eloisa, to say that one thing that is unique in Connecticut too is that this universal preschool, universal childcare does include family childcare, and they're a critical part of the system. So that too adds complexity, but we think it adds responsiveness to parents' needs and supports the whole system.
there was a question, when will LGPs get more information from Shine? I think that's a question that we can
Sure
answer either
What I
probably
can,
offline or.
yeah, well, I can just say that, Kristen, I think, do you have an update? I just saw an update in the email about those. I think that contract is very close to being executed, but can you just update us on that?
Sure. And I know, I believe Ken is on the call from Shine, so I'm not sure if he has any additional information that he can share. But yeah, the contract is executed with Shine, and I know that we are very close to putting out those subcontracts. There's just some legal logistics that we're trying to figure out on our end that our grants and contracts unit is helping the program team work through. So that's kind of where we're at right now. And that's the most recent information.
Okay, thank you so much.
Sure.
Ken, I don't know if you wanted to add anything, if
No,
people
thank
could
you,
see your
Commissioner.
face and
No,
say hello.
Hello, everyone. My name is Ken Taylor. I'm Vice President with Shine Early Learning. So excited to be here and be listening into this meeting and being able to contribute to the great reform efforts that are happening across the state. As Kristen said, we are trying to finalize the subcontract language with the LGPs. We had an initial meeting with a subset of LGPs earlier this week. We're going to be getting with everyone else as soon as we can get something on the books, and then we'll be getting regular meetings going, within the next few weeks, on into the fall, and that notification will be coming out soon to everyone. So really excited to be getting that ball rolling.
Thank you so much. Okay, now I think it's time for public, if the public has comments or questions.
Yeah, so I added in the chat once we reached the 10-minute-ish mark that members of the public could begin to write some comments and questions in there. So some of that question about Shine was from the public.
Okay, great.
There are some comments and stuff.
Any questions?
There's another question. There's a bigger question from Verna. But given the time, Verna, is it possible to answer this offline? It's a
Is there a question
on
that will
price
help others
gouging.
know? Oh, yeah, that sounds specific. Okay, that's not. I'm
Yeah.
happy to talk to Verna offline.
Yeah, she said, of course, no worries. Great. So, but it's a important thing to bring up. It's just we'll take this last question from Meryl. Where are you in the process of rewriting the Care for Kids regulations?
I'll turn that to Laura Bennett. Where are we in the process?
And we have other members from the team on this call.
Laura, you can coordinate if there are others that may have more.
Yeah, I can comment on that, and anyone, other team members, feel free to chime in. But we have currently developed a very rough draft, and we are moving through the revision process with our federal technical assistance team. So we are moving through, but we do have a very rough draft developed, and we're moving through that now.
Okay. Great. All right. Well, Lieutenant Governor, I don't know if you're still with us. Do you have any closing comments after this busy meeting? She may have had to leave. Okay, well, I just thank you all for your engagement, and you're going to help guide this ship. So we're going to need you more than ever in the coming year. And it's an official role, but also know that we're available outside of this official meeting if you have guidance or feedback or things you're hearing. It's so fun to be together. So great to see you all.
And I'll just say one last thing. I'll be sending a follow-up email on some of the things that were presented today, but also for early childhood cabinet members and the public. We are just trying to finalize the room, but we plan to have our next meeting on September 10th at the same time, except until 12 in Hartford. So you'll get more information on that, but just a FYI.
Great.
Thank you so much.
Have a great Tuesday, everybody.
Thank you.